Lately I had to deal with a couple of patients who had tried to undergo detoxification therapy and ended up with some severe troubles. So I thought it would be helpful if I could tell you a few problems that can occur when you go through detoxification therapy. I'm Karen von Margot-Guevara, Western-trained medical doctor. I obtained my license in 1996 from the state of Bavaria after studying medicine in Germany and in France. It's about 10 years now that I started working hands-on. It's a gift too, I have to admit that, where you are able to really dive deep into the body and feel, sense what is going on in the body. Probably gifts that old-fashioned physicians had, and oftentimes I actually smell, sniff and take the patient in an old way too, like checking the urine, checking the smell people exhale. It's important, we cannot bypass this because it tells you a lot about the state of the patient. These elements of a physical examination may not be taught anymore today, but they're really important. And with the patients I've been seeing lately who go through severe detox crises, it's been really helpful to kind of have these abilities. Today I work in partnership with Dr. Daniela Huterara, a naturopathic medical doctor. She's the one who takes care of the IVs, IV therapy, and she has a frequency approach on reading the frequencies in patients, panels that we extract as far as data from the readings of the so-called Azura machine that are really helpful in understanding the patterns, biochemical patterns, toxicity patterns, hormonal neurotransmitter profiles that patients have. Our understanding of disease is that the body is oftentimes simply impacted by toxins, be it heavy metals or chemical toxicity, that create the upset that leads to disease in the long run. And that correcting the toxicity, helping the body to revamp its own detoxification mechanisms, is actually the way to help the patient heal. A disease that presents with specific symptoms is like a car that has the red light coming on. And using a pill would be almost like trying to smash the red light instead of going to look and see what's really wrong with the car. If we look, for example, at Parkinson, you have specific symptoms. You have a rigor, you have the typical gait, you have shakes, etc. You have an impact on that part of the brain, and it's treated with Sinemet, it's treated with drugs that are anti-Parkinson drugs, dopamine, etc. But what about looking into why does that part of the brain not work anymore? What's really behind it? There are structural postural problems that prevent blood flow back from the brain into the body. There is the support of blood to the brain, to the subcortical centers that is impacted by the structure of the patient, and there is a biochemical upset that co-creates the problem. There's a stenosis of certain smaller blood vessels that feed those subcortical areas. Looking into the biochemical upset leads to the understanding that heavy metals are a causing factor in this. There are specific enzymes that are inhibited in their function by heavy metals. Let's say lead, mercury, arsenic, cadmium, they all play a role in this upset. So anybody who undergoes a scheduled, a planned detoxification, where it's not a matter of life and death, which I've seen too, unfortunately, needs to have their dental fillings, metal crowns, implants sometimes even, and whatsoever metal in the teeth in the oral space removed. Any type of detox program will activate the metals. It'll wick them into the metabolism from their seat in the teeth, because teeth are not just inert materials like crystals. They have a tubular structure, they're like porous, they're alive. So the metals will be wicked from there into your blood. So as long as you have your metal fillings in your mouth and you try to go through a strenuous detox program, it'll make your symptoms worse. So it makes sense, before you have fillings removed, before you get everything scheduled, to remineralize your body. And you can use substances for that are so-called natural chelators. Chlorella, spirulina are part of that. Not everybody fares well with them though. If you're, for example, low in cellulase, you may have an upset of the stomach when you use chlorella or spirulina. So be careful, listen to your body when you use these substances. The patients I dealt with lately had tried detoxification programs that were moved through chelation provocation tests, so-called urine challenge tests that are based on synthetic chelation agents that are used to remove metals from the body, and the urine is then sent to the lab and calculated as to the load that was discharged. What Daniela and I came to understand is that some of these tests, or many tests, oftentimes show up as falsely negative. They do not produce heavy metals because there is a major shutdown of elimination pathways in these patients. So it happens oftentimes that these test results come back and nothing much shows in the urine, and the patient is told, you don't deal with heavy metals. So if the testing MD or NMD doesn't have sufficient knowledge of the right choice of chelation agents and tests, nor takes the precautions into testing organ function and compatibility, which is like a skin test, an allergy test, those tests will again, for once, be falsely negative or even dangerous for patients. Synthetic chelation agents that we have these days, EDTA, most of all calcium EDTA, DMSA and DMPS, do not only have different chelation spectra, but differing consequences for the overall health of the patient depending on their impacted metabolism and their organ function. Patients who are overloaded with sulfites and sulfates, they will struggle and possibly deteriorate when DMSA and or DMPS are used. What Daniela and I understand by now too is that if you use calcium EDTA, which is the least invasive synthetic chelation agent, mercury can be provoked and will appear using its natural pathway of excretion, the liver and the bile, so it will show up in the feces. When EDTA is used, you need to have a stool test done, not just a urine test. Patients appear falsely negative for mercury when only urine is tested. When patients have major shutdowns of their main pathways of biochemical and physiological excretion, they are unable to produce valid test results. They need to be primed per IV with adequate substances before they can undergo testing. Otherwise, the test will be falsely negative. This priming is basically a help for our God-given natural elimination pathways via the liver, the glutathione complex, to work. This is a combination of substances that we can just summarize under glutathione complex. Glutathione itself, selenium, vitamin C, and B2. Sauna programs, for those who have shutdowns of their elimination pathways, they may get overwhelmed. Be careful with the use of these synthetic chelation agents when you already have symptoms that show you have a sulfate overload. Neurological afflictions, Parkinson, ALS, MS, issues, let's say with garlic, with onion, with red wine, with eating cabbages, with taking vitamin B complex, B6 would trigger this. If it gives you headache, nausea, etc., you deal with a sulfate overload. If you add synthetic chelation agents like DMSA or DMPS to this mix, you may have a short moment of a detox that will alleviate symptoms, but in the long run, within weeks, you may actually deteriorate.